Good morning, everyone, and thank you for being here. We have important information to share about the impact of COVID-19 in Cumberland County. Dr. Jennifer Green, our Cumberland County Public Health Director, will give you an update. Mike Nagowski, CEO of the Cape Fear Valley Health System, will discuss what is happening at the medical center. And Shirley Bolden, the Director of Health Services for Cumberland County Schools, will speak on behalf of the school system. A little more than half, about 55% of Cumberland County residents who are age 12 and older are fully vaccinated. They got the shot to help protect themselves, their families, and others. I am so thankful to everyone who made the decision to get vaccinated. I am hoping more and more people will choose to get the vaccine in coming days. All COVID-19 vaccines and COVID tests are provided free of charge regardless of whether you have health insurance or not. The vaccines are safe. Scientists have been working on this technology for 30 years. The vaccines are effective. Studies show that they are nearly 100% effective at decreasing the chance of hospitalization and death. If you're not vaccinated, please don't wait another day to get your shot. Each day you wait, you are putting yourself at greater risk of contracting the virus. The Delta variant is much more contagious than the early version of the virus. The numbers are showing that almost all hospitalizations and deaths continue to be among people who are not vaccinated. In response to our high transmission rate in Cumberland County, the county is requiring masks to be worn inside all county buildings, regardless of vaccination status. The best protection against this virus is the vaccine, and I encourage everyone to get vaccinated. Clinics are being held at various library locations on Saturdays in August, and I want to thank our library director, Faith Phillips, and the library staff for coordinating with our health department and setting up these clinics. Tomorrow, Saturday, August 7th, you can go to the headquarters library or Spring Lake Branch Library from 10 a.m. to 4 p.m. On August 14th, you can go to the Hope Mills Library. On August 21, the East Regional Branch Library. On August 28th, the Spring Lake Branch Library. And our Department of Public Health offers the COVID vaccine weekdays from 9 to 4 p.m. Get your shot. It's easy, it's free, it's the right thing to do, and also the respectable thing to do.
Thank you, Chairman Evans. Let's start with the numbers. In the last 7 days alone, 837 new COVID cases have been reported in Cumberland County. Statewide surveillance data indicates that the large majority of these cases are from the highly contagious Delta variant. Importantly, most of these cases are among those that are unvaccinated. The percentage of tests that come back to us positive is above 15%. We want that number to be closer to 5%. Hospitalizations are increasing. We have not seen numbers like this since December and January. The result of these alarming statistics are that 339 residents of our community have died throughout the COVID-19 pandemic. Importantly, these individuals are getting younger and younger. We have individuals in their 20s, in their 30s, in their 40s dying from COVID-19. These deaths are largely preventable. In Cumberland County, as Commissioner Evans noted, 55% of our individuals over the age of 12 are fully vaccinated. While we've seen an increase in demand over the last few weeks, I'm worried about what the fall will bring if we don't get more of our residents vaccinated. For those that are not yet vaccinated, here are the facts. First, the Delta variant is more contagious than previous strains. To protect yourself and your family members, please wear your mask in public indoor settings. Second, we have safe and effective vaccines to prevent severe illness, hospitalizations, and death. Your risk of hospitalization and death is 25 times lower if you're vaccinated. These vaccines have been rigorously monitored for safety concerns more than any other vaccine in history. Third, while the Delta variant is causing more breakthrough cases than before, this still accounts for a small percentage of cases, and most of these cases are mild. We're out of time. Don't wait to vaccinate. You can come to the main branch library this Saturday to get your free vaccines, no appointment needed. You can come to the health department Monday through Friday, 9 a.m. to 4 p.m., no appointment needed. You can also visit our healthcare system at Health Pavilion North or Center Pharmacy Tuesday through Friday, no appointment needed. You can find other vaccine locations in our community at vaccines.gov. For those that are vaccinated, I know that you're frustrated. Please continue to wear your mask in indoor settings as well. Talk to your friends, talk to your family members, talk to your neighbors, to your congregations about getting vaccinated. Drive someone to a vaccine site. If you're a business owner, make sure your employees have the opportunity to get vaccinated. If you're a parent, help your 12 and older kids get vaccinated. We are in this together. I'll now turn the mic over to Mr. Mike Nagowski, Chief Executive Officer of Cape Fear Valley Health System.
Thank you, Dr. Green. Thank you for all your fabulous work in trying to keep our community safe. Please get vaccinated. There is a lot of information out there, but let me give you some statistics about what's happening in our community. In January, at the height of the pandemic, at the height of hospitalizations in our country, at Cape Fear Valley, there were approximately 130 people who were hospitalized who were COVID positive. This is in January. That was our high watermark. Then what started happening in January? Vaccinations, right? It really started to take hold. And what we saw at the health system is from a high watermark of 130 all the way down, continual downward trend to 14. That was our low watermark, 14 people who were hospitalized with COVID. And then in the last 6 weeks, as the Delta variant has taken hold, and we describe the Delta variant as COVID on steroids. It is the real deal. So what has happened? From a low watermark of 14 to right now, today, we have 89 patients who are COVID positive in our hospital. It's all about the unvaccinated at this point. Almost every single person who's in the hospital is unvaccinated. And the thing that's most heartbreaking is that we are now at a high watermark of people who are on ventilators. And when you're on a ventilator, it means we're breathing for you. And your chance of survival continues to go down. The people who are experiencing mortality today are far different than the people who were dying earlier in the pandemic. We all remember, right? Nursing homes, the people in their 70s, 80s, 90s. We even had a person who was 109. I think she saw the first pandemic. Well, that's not what's happening anymore. We have people dying in their 20s. The average age of death due to COVID here is 15 years younger than it was at the beginning of the pandemic. Please, if you have not been vaccinated, get vaccinated. You may be aware of this. Yesterday, the health system announced that the vaccine is now mandatory for everyone associated with Cape Fear Valley. All of our employees, our physicians, vendors, contractors. We believe in the science. The science is clear. And it doesn't matter what the statistics say anywhere else. What we're seeing here is what's happening in our community. So thank you for the opportunity to talk about the vaccine And thank you to everyone who has been vaccinated. And I hope this will move other people to receive the vaccination.
Good morning. Thank you for inviting me here to share with you updates on Cumberland County Schools' COVID-19 safety protocols. From the very beginning of the COVID-19 pandemic until now, our school system has made decisions based on the science and guidance from our medical professionals. Our top priority for this school year is to operate in person all year long as safely as possible. Our CCS dashboard data from July 23rd through the 29th reflects 14 positives and 29 quarantines. With a focus on health and safety of our students and staff, we've reviewed the updated guidance of the North Carolina Department of Health and Human Services and recently shared the newly revised Strong Schools North Carolina Public Health Toolkit, including the recommendation for universal masking for students and staff. We believe that universal masking can help prevent the spread of COVID-19 in the school setting. In keeping with the recommendation from local, state, and national health officials, Cumberland County Schools Superintendent Dr. Marvin Connolly plans to recommend to the Board of Education universal masking for all students and staff at the start of the 21-22 school year. The board will consider the superintendent's recommendation at the August 10th Board of Education meeting. If approved, the mask requirement would be for pre-K through 12th grade students and staff regardless of their vaccination status. And the board would periodically review COVID-19 metrics to determine the length of time universal masking would be required. Based on updated guidance from health officials, universal masking would reduce the number of students required to be quarantined in the event of a COVID-19 exposure. In addition to the universal masking recommendation, Cumberland County Schools will also aim to maintain a minimum of 3 feet distance between students and 6 feet of distance between staff. We also encourage all eligible individuals to take the COVID-19 vaccine to help slow the spread of the virus. We've partnered with local healthcare organizations to provide thousands of employees, students, and community members with convenient access to one of the COVID-19 vaccines. Thanks to federal funding, COVID-19 testing will also be available and will provide another layer of protection to help keep students and staff safe. While not required, parents will have the opportunity to opt in to free COVID-19 testing for their student. Cumberland County Schools and offices will refer individuals to diagnostic testing who have symptoms of COVID-19 through the North Carolina Department of Health and Human Services partnership with MACO. Cumberland County Schools will offer free antigen testing, and we will do those on site to facilitate quick COVID-19 diagnosis. Rapid antigen testing works to prevent in-school transmission while minimizing face-to-face learning time lost. Once a final decision is made regarding masking and other safety protocols, we will update our school system family and the general public. We're grateful for the continued partnership with local, health, and state officials as we work collaboratively to curb COVID-19. Thank you.
You know, I was sitting here. First of all, I want to thank the media for being here, for being outsourcing, getting the information out to our citizens about this virus. Every one of us that are sitting here on this stage, we are serious about getting this word out. We want everyone to become vaccinated, to wear your mask, and do the things that are necessary to protect you, your family, your residents, your neighbors, everyone. It's that important. We are not standing and sitting here just to be doing something. We care about each resident here in Cumberland County and beyond. So please, again, thank you for being here. Thank you for helping us to get this word out, that this is a serious thing, and it's no time to be playing with your life or anyone else's. Now, we will open the floor for questions.
Either Dr. Green or Mike. We're doing pretty good here in Cumberland County in terms of vaccines. But in comparison to other counties with similar vaccination rates, we seem to be at a higher rate of infection. Can we explain why that's the case?
I can start, and then if you have anything to add. By and large, what we see is that counties that have, in areas around the country that have higher vaccination rates tend to have lower transmission rates as well. But we know we have a different situation now. We have the Delta variant. It's much more contagious than previous strains. So I think that's one of the contributing factors. We also have a fairly young population here. We are a very transient community. We have several college university campuses. We're about to have them come back to campus. We have Fort Bragg here. We have a lot of people moving in and out of our community, which I think can contribute to that transmission as well. So I think there's a lot of factors going on that contribute. But in general, you're right. Communities that have high vaccination rates tend to have lower transmission rates. There's just some unique things happening here in Cumberland. And Mike, if you have anything to add to that.
Dr. Green, I'm curious to know what the conversations look like between the Cumberland County Health Department and the federal government when it comes to vaccine boosters. Any word yet on when they may be available in Cumberland County?
So what we heard this week and saw the recommendation from the World Health Organization is that we should not do boosters yet. The FDA has not approved booster shots yet. So we won't administer any booster shots until that has that emergency use authorization from the FDA. So no booster shots yet.
A lot of folks who have their shots who are frustrated about having to do this once again to protect the people who didn't get the shot. It's frustrating. What do you tell folks to encourage them to get the shot? We keep hearing that, but I don't think it's sinking in. At Fort Bragg, for example, it's mission essential. I'm sure the Secretary of Defense is going to say all active duty military folks get the shot. What do we need to do to drive home the point?
I know that this is frustrating. This is the conversation I have around my own table at my house, and that it is those that are vaccinated are frustrated. But I'd ask that you channel that frustration into conversation. We know that your conversations with your family members, your friends, make a difference. It makes a difference what we say on the stage as healthcare providers and local officials and school system officials, but what the conversations you all have around your dinner table and with your friends and your family members makes a difference. So please, I know you are frustrated, but we can't get out of this if we don't have community's participation, right? We need you to get vaccinated. So have that conversation with your friends and family members and help them to get vaccinated. And I don't know if others on the stage want to respond to that as well.
Mike, I'd like you to update us on where we are in terms of beds at the hospital, intensive care.
Gilbert, thank you for that. So there's no secret across the nation we're facing shortages in all areas of our workforce, and healthcare is not immune to that at all. There are nursing shortages, tech shortages, assistant shortages, and we're feeling that here at Cape Fear Valley. We've been very fortunate this past year with a tremendous recruiting effort. I think last weekend we had over 190 people come to our recruiting event at the Healthplex. We are full at Cape Fear Valley. We are no longer accepting transfers from outlying hospitals, and we routinely do. Our helicopters go and pick up patients and bring them to the medical center frequently. But we are holding patients much longer than we normally do in the emergency department, waiting for beds to open up. We are monitoring on a daily basis our bed capacity. We're monitoring our ability to continue surgery, to continue providing trauma care. We think that over the short run, we're going to be okay, but that same monitoring holds true with COVID. Our ICUs are full, and they're full primarily because we have so many COVID positive patients on ventilators. So please, the data's clear, vaccinations work. They keep you out of the hospital. Even if you do contract COVID, most likely you're going to get a mild case of it. Everybody in my family, my 75-year-old mother-in-law is vaccinated. My wife is vaccinated. I'm not going to give you her age because I got to go home tonight. But she's about my age. My 31-year-old daughter is vaccinated, and she plans on continuing to have more children. My 13-year-old daughter is vaccinated. My son-in-law is vaccinated. My son is vaccinated. Please move forward with this. The health system is here. The health department is here. But the community needs to also step up.
You recently said that all hospital employees have to get the shot. Deadline
October 1.
October 1. Where are you in that? How is it being received? And what happens to those who do not want to get the shot?
Yeah. So again, thank you for that question. We conducted over the past week 3 separate town halls specifically regarding the vaccination process. I wanted to hear from frontline folks about their concerns. The health system right now is approximately at 60% vaccination. The last 2 days, we've seen a tremendous uptick as we've made this announcement. I expect that everyone who's associated with Cape Fear Valley by October 1st will be vaccinated. We do have some exemptions. We have a medical exemption and we have a religious exemption. But this is no different for us than the flu. Everybody at Cape Fear Valley is vaccinated for the flu vaccine unless there's a medical reason or a religious reason. And it is a condition of employment for us. So by October 1st, you'll either have all of your vaccination shots or a medical exemption, or we will help you find a new place to work.
Dr. Green, is there a place for folks to get $100 for getting a shot here? I know that's going around now. Are there any locations here? And also, I want to ask the chairman, any indication that the county's going to kick in some money to do a local type encouragement or incentive to have folks take the shot?
So at the health department, we are not part of the $100 vaccine program, but our partners at Fayetteville State and the Old Medical Society North do have those $100 vaccine cards. It's $100 for the person getting vaccinated and $25, I believe, for the driver. And so they have vaccination clinics coming up this week and next week as well. And I'll let the chairman answer.
And yes, sir.
Is the county going to kick any money to help the department say, hey, here's our $100 since they're not part of the statewide program?
And whatever Dr. Green deems necessary for us to do, we're standing with her 100%.
And Gilbert, I'll add to that. We have reviewed quite a bit of our funding that we already have from the state and our pass-through money from the federal government, and that funding does not allow us to use it on incentives. So that money really has to come from the state level, but all of our COVID dollars that we've received so far cannot be used for incentives.
It just seems like that's working, though, as opposed to the $1 million giveaway. It seems like people are responding to $100 to take the shots. It's a shame that that's what it's taking to make it happen, but
right.
If you're pulling out all the stops, why not consider that here?
Yeah, so we have to have a funding source to be able to do that, and the funding that we've received from our state health partners doesn't allow the purchase of incentives. That money really, the $100 incentive program really came at the state level, and then they designated providers. And we do have a provider in the community that's doing that, again, in collaboration with Fayetteville State, but it just didn't allow our health department specific money that we received to be able to give those $100 incentives.
Dr. Green, while you're up there, if somebody just doing the math, middle of August right now, and if somebody were to get the first of the Pfizer vaccinations, wait a month to get the second dose, then it's still 2 weeks beyond that. So if everybody got vaccinated today, we'd still be in a susceptible danger zone until almost 1st of October, or
Right. So it takes, there's several options for vaccines. So if you, the shortest option is for you to get a J&J. You can get that single dose of J&J, and then 2 weeks after your J&J, you'll be fully vaccinated. So that's an option for individuals, especially if you are a little squeamish with needles. That's a great option for you. Pfizer, you're right, you need at least 3 weeks, and then another 4 weeks from Moderna. So we are looking at a long-term game here. We need people to get vaccinated quickly. That's why we're urging people, because it does take time to be fully vaccinated. We're urging you, do not wait. I'm in the back of my mind, I'm thinking about Labor Day. We're less than a month out from Labor Day. So if you are planning to travel for Labor Day, come today, so we can get you at least a couple doses before you go on your Labor Day travel, especially if you're going to visit family or friends or getting on an airplane. We want you to make sure that you are vaccinated.
Dr. Green, I'm with Greater Fayetteville Business Journal. For businesses that have gone back to conducting business face-to-face, do you have any advice for extra measures they can take to protect themselves and their customers?
So a few things and come to mind. First and foremost, encourage your employees to get vaccinated. That is the most important tool that we have right now. And encourage them not to just to get it, but offer them an opportunity. Make sure that they know that they can maybe take time off work to get it, if it takes an incentive for them to get it. But just like in the county, County Manager Amy Cannon made sure that all of our employees would not be penalized for taking time off work to get vaccinated. So that's the first thing. Second, if you are an employer, as Governor Cooper has recommended, as the CDC has recommended, as we've done in the county, as we've done in the city, have your employees wear their mask regardless of vaccination status when you're indoors. We want you to continue to have those cleaning measures in place. That's critically important. We're hearing about making sure that if your employee is sick, let them stay home from work. If you're, and certainly if they're positive, don't allow them to come to work. And then help work with us to quarantine your employees as appropriate. We're here to help you. We can provide guidance to you if you have questions as well.
I've got a question for Ms. Bolden. A lot of concerns right now and questions have been raised about testing in Cumberland County schools. Any word on how that will be carried out?
Yes, thank you for that question. We will have a company, Mako. They will come in and they will perform all testing. It will not be any school employees.
Does the county have any connection with that? Are you working with the county?
Absolutely. We have a close partnership with Cumberland County Department of Public Health. So what will happen, they will complete the testing at the school. The Board of Education will be notified. The Office of Health Services will be notified when there is a positive case. We will complete the investigation, the contact tracing. We forward it over to the health department, and then they take it to the next step.
And you said there are cases now that year-round schools have started back. There are cases within Cumberland County schools in quarantine. Can you specify more on what the policy is for quarantining students and staff in some cases?
Absolutely. So, of course, if you test positive, you're going to be isolated for 10 days. If you are exposed, you're going to be isolated up to 7 days or 10. So this is what we do. So if you, day 5 after exposure, you can take a test. In 48 hours, you remain symptom-free, you have a negative test result, you can return to school. If you choose not to test your child, you can wait 10 days, and if they remain symptom-free, and what we have in place, we have contact tracers who call and do nothing but symptom checking. So we're checking with them all 10 days. So at the end of that 10-day period, I will send an email to the principal that says, Lucy Jane is clear to return to school. Now, if the parent wants, they can do the whole 14-day quarantine. But if we want to get our kids back as quickly as possible, so we encourage them to test on day 5. And then, of course, if they choose not to, they can return on day 10.
For some parents, there might be a level of concern with their children quarantining, missing instruction. How are you ensuring that that instruction is not missed within their regular classroom day-to-day activities?
They will have access to all classes. So what we did last year, when I would place a student, my department would place a student under quarantine or isolation, they would have access to log in to the classes, and they'd be able to participate virtually so they didn't miss any instruction. But we do prefer that our students are face-to-face, so that's why we're encouraging the vaccination and mask wearing.
And one last question, as far as staff and quarantining, how are they going to continue educating these students? If they're in quarantine, will that class be moved virtually? Can you specify on that a little bit more?
We will provide substitutes. So if the teacher is test positive, for example, but they're well enough, that teacher will log on virtually. We'll have a substitute in the classroom for classroom management, but they will still have the benefits of their regular classroom teacher if she or he is well enough to teach.
What is the cost for someone who catches COVID to come to your hospital and have a ventilator, stay an extensive amount of time in the hospital? Can you talk about that? And the reason I'm asking that is because it's thousands, hundreds of thousands of dollars as opposed to giving $100 to get a shot or even $200 for each person. So if you weigh the two in terms of getting incentive to keep a ventilator out of your road, why would we consider, since we see that it seems like giving folks $100 is paying it off to keep them out of your hospital bed? So talk about the numbers.
Yeah, Gilbert, I don't know the cost benefit of paying people to get vaccinated. I can tell you, you are right. Someone who ends up in the hospital in an ICU bed on a vent, it's hundreds of thousands of dollars. And it's not just the staff time, it's the incredible amount of pharmaceuticals, the ventilator time. Hospitalization is very expensive. I can see how you could draw a correlation about the vaccination cost. But I think more than the financial benefit, it's about keeping someone's loved one out of the hospital, having them there around. I know this. If the Delta variant was the first instance of COVID, the United States would look much different. We'd have a lot less grandparents in this country. We're glad that the Delta variant came last, but just think about this. What's next? What's after the Delta variant? And the only way we're going to not have to deal with that is if we can bend this curve, if we can slow down the transmission and the infection rate. And the only tool we have in our defense against the virus is the vaccination.
For children that are younger than 12, when do you think that will be approved for them? And also, when do you think the vaccine will receive full FDA authorization?
So that's a good question. So we don't know the answer to that yet. We're estimating at least it'll be winter time before we have, and maybe even early 2022 before we have an EUA or an emergency use authorization for kids under 12 to get vaccinated. And similar for our full FDA approval. That's still there. I know they're fast tracking it, but we still have some time to go. But what we want people to know is that even under an emergency use authorization, that does not mean that the vaccines have not been studied, evaluated. They still go through a rigorous scientific process to make sure vaccines are safe for you to get. So don't wait for that full FDA approval. We will lose many, many more lives between now and then if we wait for that full FDA approval.
Dr. Green, I have a question for you. So if the rate continues to go as it is right now and things continue to evolve with COVID, even with people getting vaccinated, since it does take time to get those second shots and things like that, do you see hypothetically a future where a stay-at-home mandate would be helpful in getting those numbers down?
You know, I can't speak for the governor's office, and that would come from his team. But what I'd say to that is that's avoidable, right? We can prevent that from happening. We know what to do, right? We know what the strategy is, and it's pretty simple. Get vaccinated and wear your face mask. Those two things. And so if we want to, we heard the governor say, if we want to avoid a stay-at-home order or further mandates, then we need to do what's right. We need to get people vaccinated so that we don't have to get there or put further restrictions in place.
Isn't it just a fact that viruses mutate? That's what they do. And right now, we've mutated to the Delta variant stage, and I've tried to look ahead and see what's out there in other places in the world, and there are other variants right now that are possibly the Delta variant on steroids. And I don't want to scare people as much as I want you and Mr. Nagowski to remind people that the time to get the vaccination is now.
It's now. Viruses mutate all the time, and they get stronger. They learn. They become more deadly. They become more contagious. As Mr. Nagowski said, if we had the Delta variant first, we would have a lot more people that wouldn't be with us right now. But our viruses mutate and they learn and they get stronger, and we don't want to be in a place where our vaccines don't work against the variants. So right now, our vaccines seem to hold up fairly well against the variants, and we want to make sure that while we have effective vaccines, that you are getting vaccinated, not in a couple weeks, not in a month, not right before Labor Day. Do that today. Do that this weekend. Encourage your family members to do the same.
Thank you for being here today. We really appreciate it.